Assalamu alaikum, hello and welcome to the Health Show here only on the Islam channel with me, Alistair Greener. Tackling health problems every week, we're joined by a health expert within their specialised field who discusses the prevention of health issues or concerns that we or our loved ones may face. Looking at how you can change your health and lifestyle for the better, the Health Show offers an alternative viewpoint from our health experts who attend the show. And we really hope that this will help you to be guided in the right direction. So if you suffer from any medical issues or have any health concerns, or for that matter if you know anyone who does, then do tune in each week as we'll be covering a wide range of topics and offering alternative viewpoints from our health experts. If you'd like any further information on our programme or any of the topics we discuss, then please do get in touch at healthshow@islamchannel.tv. Today we're looking at general health. Now, being healthy is being more than just thinking of your diet and exercise. It's about understanding how your body works and what it needs to stay healthy. To discuss this topic, it's a pleasure to welcome Dr Imran Gohar, a General Practitioner from Sydenham House Surgery in Harlow. Dr Gohar completed his GP training in Harlow in 2007 and has worked in a variety of surgeries since then. His experience has led him to look after patients in almost 30 nursing homes and residential care homes. In 2010, he joined Sydenham House Surgery as a partner and now manages the surgery as the lead GP. Dr. Gohar, it's great to see you. Thank you very much indeed for coming in.
Hello. Hi.
We've got lots to talk about. It's a huge area. But first of all, we're going to have a look at a video because approximately 20 specialist doctors from Cameroon, France and the United States travelled to meet communities in Bangu, a village located in the west of Cameroon. Their purpose was to provide hope and free healthcare to poor populations who have no access to adequate health services. Let's look at what happened on their visit.
Like me, at 67 years old, there are already organs that are tired, such as the prostate, heart failure. I have a lot of aches. Actually, it was this suffering that brought me here. I think it is very important that medical technicians get closer to patients.
I'll tell you, during the 2 days, there were many miracles that took place. Many patients are being screened. Just in the ultrasound cases I had to do this morning, there have been breast cysts, enlarged prostates, many parents who have stayed a long time in the campaign just because they have no means.
Cameroonians die very quickly, very early at 50. And you even have to be lucky to reach 50, 55. Many die very quickly just because of a lack of medical follow-up. We see in all these medical workshops competent men coming from both sides, the hospitals of Yaoundé, Douala, Americans and others. I really feel a sense of real satisfaction.
It's great watching a video like that where we see help being given to people in poor areas because it's something we take for granted in the UK, certainly, this ability just to go along and see a doctor because of our incredible NHS. But that's not the case for so many places around the world, isn't it?
Absolutely. I think we are quite fortunate in that respect. I have travelled got a lot of places in the world. I worked in America as well. And to be honest with you, I think NHS is quite unique. The way we work and the word cradle to grave, I think we literally follow that. Free healthcare is something which people don't understand how important, how fortunate we are. I have seen people in America lining up in the general hospital, free hospital, and the queues were, quite long. And to be honest with you, the level of care was like any third world country. So then there was a discrepancy. If you go to the private hospital in the States, the healthcare was amazing, So I think here we are fortunate that we have a equal healthcare for everyone. Same thing in Canada, actually. People go to the GP. I went to the GP with my nephew actually once, without telling them that I am also a GP from UK, and they basically charge per consultation over there. So he went for a problem on his skin on his arm, and then he mentioned something about his acne. He said, "Hold on a sec, go out, make another appointment." So just within 5 minutes, he charged him twice, actually. Wow. And then I was just thinking, hold on, here in 10 minutes, how many patients we see who come with multiple health issues and resolve them and
well, that's one of the things that happens. I know I've done it, where you go to the GP and say, while I'm here, I've got this, and I've got that, and I've got the other. So you all of a sudden this big list. Yeah. Let's start with the real basics here, first of all. Define for me what a GP is and how they work within the NHS system.
I think it's an interesting question, actually. GP, a lot of people say you can call them multi-specialist. The role of the GP is not only seeing the patient, listening to them, investigating them, diagnosing and treating them, or referring them to further speciality if needed. But I think there is a stronger concept of GP practice now, that GP is a link between a physical health or health care to the social care, actually, and there is a link. So for example, a patient who's ill, living alone, needs a lot of care. For example, there is an issue at home which can trigger falls and things. GPs can see those patients, arrange certain things so that which prevent him to fall, involve social services.
And it's quite interesting, isn't it, that the GP for most people will be that initial point of contact when it comes to your health.
Yeah, absolutely. And sometimes it can be quite silly things. For example, I have seen patients for, coming to ask for special mattresses for their mothers. Yeah, and then you have to guide them, okay, where to go and who to speak to. But yeah, I agree with you. I think they think wherever they get stuck, they go to the GP and ask them. And to be honest with you, realistically, we are kind of in the middle of the whole healthcare in this country.
You're almost like the oracle of knowledge when it comes to anything to do with health. And I think one of the things that people don't realise is the fact that although GPs, hence the name General Practice, have a very broad knowledge, the one thing you do have is this ability to recommend and to guide people to more specialist fields should they need it.
Yeah. Majority of the time, I think people come for general complaints. I think I categorize general practice or our consultations into three categories, actually. One is starting from a minor illnesses, for example, cough, cold, viruses, back problems, mild anxiety, depression, infections. Then the second category is a complex problems where you need a continual support and healthcare. For example, chronic obstructive lung disease, heart failures, kidney failures, hypertension in some cases. And then the third category is medical emergencies. A general day of a general practitioner actually have all these three components. Actually, we see some of in one day. Yes, of course, majority are the main illnesses. Minor illnesses, which basically can be treated at home or by doing certain measures. But the other problems are where GPs either need to investigate, treat, or refer the patient to the specialities in the hospital or in the community.
And when you go to see your GP, one of the things we were talking about just before the show is this whole thing about the relationship. And it's incredibly important, isn't it? Because this is somebody who the chances are you're going to be seeing them for certainly as long as you live in that particular area and as long as that particular GP is still working in that area. So it could be for a matter of some years.
Yeah, it's not going to be wrong, as I said before, cradle to grave relationship. I think we see patient when they're born for their checks and things, then all the immunizations, and then till the patient die actually. So I think the relationship is literally since you're born till somebody die actually. So it's a very important relationship. And I think patients also understand that how important the role of the GP is in different components. How to use it, which help them more, is something related to education, how we educate our patients, how to promote healthcare and things like that.
Now, because it is quite personal, you've got a relationship with somebody. We have many of our viewers who will be women who only want to see a female GP. There will be people who maybe just don't necessarily click with that particular GP. How easy is it to actually move GP? Is it something that the GP might take a bit personally and not be too happy about? Because it's certainly something as a patient you might feel reluctant to change and feel that actually I'm stuck with this GP.
No, absolutely. I think the concept of NHS, the way we work nowadays, is all about choices actually, and this is the fundamental choice of a patient who you want to see or you don't want to see basically. So it's pretty easy, and I think patients do move surgeries for various reasons. Not only that they can't get on with the doctor, maybe some other reasons. So it's pretty easy nowadays. And I don't think any doctor take it personally. So people can go on internet, people can search what kind of surgery they're looking for. Some patients like bigger surgeries, some patients like smaller surgeries where they have a more relationship with their doctor. So they can choose whichever they want.
And of course, if you're in an urban area, you have an even greater choice.
Absolutely.
And if you do move, I presume you don't get put through loads of questions and things like that. Why are you moving? Why do you want to see this doctor? Why do you want to see that doctor?
No, absolutely not. I think no questions asked. And according to the social healthcare bills and all those things, I think patients are quite free to come and join any surgery. And to be honest with you, we don't even ask for, if somebody's moved to a new area, we don't even ask for different documents to get registered initially, because we realize that it's hard to get bills and things in the beginning when you move to somewhere new. So we're pretty flexible, and I think patient can register very easily everywhere. And if they can't, then they can either change the surgery or raise the issue to some higher authorities.
And the interesting thing is, of course, it's only the beginning of your health journey. And I want to talk a little bit about the reasons that people go to see the GP, and we're going to talk in a while about the people who maybe come when they don't need to come, because there are lots of alternatives, which we'll get to in the second half. But I want to talk a little bit about those people who are reluctant to come and see you, because some people think, oh, I'm wasting the GP's time, or I know someone who'll be able to help me. What do you say to somebody who's not sure whether this is the appropriate time to come to the GP or not?
Well, I would say don't be reluctant, and go and speak to the GP and tell them their concern. Yes, it may be something very silly for them, but it can be very important. And I can give you an example that I have a patient who was very, proud elderly guy, and didn't want to talk about personal thing. One of the issue he came reluctantly after a while was about passing some blood in the stools, and when he came, he was constantly telling me that, oh, it's nothing major, doctor, but I just want to discuss with you because it's happening for a while. So first thing I think for the GP is to make the patient comfortable who are so reluctant, and once they start to get relaxed, they can tell you more, because history is very important, I think. And after that, we managed to refer him, and we found that he was suffering from cancer. Actually, it was dealt appropriately on time, and it saved his life.
I mean, that's the massive issue here, isn't it?
Yeah.
Because if you don't go and see your GP for what might seem to be quite minor, then actually it could progress and get worse and worse, and actually it could be life-threatening if you don't go and seek medical help at the appropriate time.
I agree. That's why I think patient, if you're in doubt, go and ask your doctor, ask your nurse, whoever you're comfortable with. Maybe sometime nowadays, I mean, internet is pretty good. Any sensible sites, for example, NHS Choices and stuff, they're pretty balanced, and you can search on that and then go and see your doctor.
Let's look at some of the common complaints that people might have in terms of their health. What are some of the things you can't do anything about that actually, you know what, you just need to deal with it and let it go? Are there any of those kind of things, or is it everything come and see you?
You know, the role of GP, actually, we can't say to anybody to go, and we can't do anything to your health issues. Sometimes people have some health anxieties, and you know, we found that you've done everything and you can't find anything, and then you have to. One thing the patient is not accepting is the psychological aspect of the problem. So physical you can check, but there is no other test for psychological or anxieties apart from a patient accepting and telling you the truth as well. So in those cases, they become a bit difficult patient actually to deal with, to make them realize that, look, we have done everything about your health, we have investigated, nothing has been found, but it may be something else. For example, you are anxious about your health.
Well, we're very aware of that these days, aren't we? Mental health has become, fortunately, such a prominent issue that people are now talking about.
Absolutely.
There's been a massive campaign to get people talking about it. And actually the GP, people often see as someone who's fixing things that have gone wrong with the body, and they forget that actually mental health is something that a doctor can help with, and a GP is probably the best person to go to.
Absolutely. I think mental health is almost 20 to 30% of our workload, actually. And from mild anxiety to mild depression are dealt by the GP without any referral to the secondary care, and very successfully, actually. So yes, a patient need to go and speak to the doctor, and I think 90% of patients with the healthcare psychological issues are dealt with at the general practice very successfully.
Just finally, before we go to break, I want to talk a little bit about this reluctance again of people coming to a GP. What would your advice be to somebody who has a relative or a friend or someone who they feel very concerned about? They feel this person should get help from the GP, but this person's saying, no, I'm fine. How do you suggest they deal with that particular situation?
It's slightly difficult nowadays because of the laws about confidentiality and privacy. We can't call the patients unless they are themselves take initiative. It's a bit easy when you know the family for a general practitioner to discuss all these things with the family, but it's a difficult area. What we suggest in those kind of circumstances to have a constructive, non-judgmental discussion among the family and the patient, and encourage him to come and go and see the doctor. And if the patient know the GP and something is mentioned by the family, then I have some patients where something is mentioned by the family where patients are a bit reluctant to discuss. When they come for some other reviews or anything, I try to just ask them a few questions and encourage them to discuss that in a respectful manner.
And you're absolutely right. There's no point whatsoever holding back when you're talking to your GP. For goodness sake, let them know.
Absolutely. And
when it comes to the GP, there's a lot of different aspects that we're going to talk about in the second half of the show. We're going to talk about the alternatives and some of the common things that people come to you, apart from obviously mental health as well. But for the moment, we're going to take a break. So thank you very much indeed. Now, don't go anywhere, but we should also stress that should you suffer from any medical problems or health concerns, it's always highly recommended that you contact your doctor or GP, as you've heard, as the Health Show gives you an alternative viewpoints to the health show, to the health concern being discussed. We'll be right back. See you after the break. Hello and welcome back to the Health Show, where we're looking at general health and the importance of visiting your GP and listening to their advice. There are many ways to stay healthy. What about yoga? Now, yoga is an ancient form of exercise that focuses on strength, flexibility and breathing to boost physical and mental well-being. Now, the main elements of yoga are breathing and postures, which are a series of movements designed to increase strength and flexibility. The practice originated in India about 5,000 years ago and has been adapted in other countries in a variety of different ways. So recently, more than 60,000 yoga lovers gathered in the city of Mysore in this Indian state of Karnataka to celebrate International Yoga Day. Let's have a look.
Race course, we are more than 60,000. The whole ground has a capacity of 1 lakh, and this internal ground has a capacity of around 60,000 plus. We have achieved it. It was jam-packed.
Health is a major issue, and to control the stress and maintaining a health, yoga is must for everyone.
It's always great to see people looking after their health, and yoga is just one of those things. What was interesting there, especially when we were talking about mental health earlier on, about yoga being great for mental health and dealing with stress and so on. Is that something that you would agree with?
Absolutely. I think yoga is a great example. For example, yoga is not only good for your physical health, but it's also very good for your mental health as well. And one of the key things we suggest yoga is for stress and anxiety management. Actually, nowadays, even for smoking cessation and other bits and pieces, yoga is quite useful and shown that it improves patients' health a lot.
And it's part of the whole program to get people moving. And it's something, again, that's very much part of your remit, isn't it? To keep people healthy, as well as helping people to solve any health issues they may have, but also keeping them healthy and talking about exercise.
Absolutely. I think that one of the role of primary care or general practice is to prevention as well. Because and educating patient as well about their health. It can be diet, it can be exercises, it can be things like yoga and other type of related exercises. So prevention is a key in managing the patient as well. Because let's say if somebody who's physically inactive, the research shows now they are high risk for everything, including cancer. So I think doing certain regime, I mean, it depends. It's not necessarily that you do yoga. You can do anything, you know, but some kind of physical exercises. Yoga is obviously better because of its impact on mental health as well. But any exercises can be good for your physical and mental health and prevent from major illnesses.
And it's interesting that you discuss this with your patients when they come in and see you. And likewise, diet as well. We all know, certainly from doing this program, how key diet is to good health. And because you know the patient and you're able to assess their condition in many different ways, I presume you're able to give quite targeted advice.
Yeah. Diet is a big issue, especially in a world where you can buy all sorts of junk food when you go to this, stores, and sometimes it's very hard to stop yourself. Even me knowing how much calories I'm intaking, it's hard sometimes, So I can understand why patients indulge into that, and result of that is weight gain and stuff. Weight gain related to diet is a big issue, especially nowadays, starting from mental health, physical health, high blood pressure, diabetes, cancer, anxiety, depression. So it's a huge, huge issue. The first thing is to identify and acceptance from the patient. Majority of the time patients come in, they talk about it, and they say, oh, I do exercises for 1 hour, doctor, but I'm not losing weight. But when you get into detail about their diet, they're taking 5,000 calories a day. Now, how can you lose weight? If you even go to the gym, doing exercise for 1 hour, you're going to lose 500 calories max, So I think when you explain that to them, that how much calories they're taking in and what type of food they're eating in is the cause of their weight rather than other bits and pieces. And so yes, diet is very important. And I think nowadays we are fortunate that wherever we go, the fat content, the calorie content is all written on the food labels. One more very important thing is I advise my patient to use the dietitian if they're in doubt. We have access to dietitians in the community, at the hospital, and they can easily get an appointment if they come to their GP and ask about some sort of help. So we have a weight reduction programs where patient can go on NHS, lose weight by dietary, by exercises measures, and it can be quite useful. But I think it's a very, very important bit of looking after yourself.
As you say, it's very much about prevention. One of the things that people often get confused about are checkups. When should they go for a checkup? Are there certain age groups who need to be going for checkups? So somebody who actually thinks, I'm reasonably healthy, I'm okay, nothing particularly wrong with me, a bit of aches and pains here and there, but nothing particular. At what point should they be going for checkups?
Well, again, it depends. I think there's no hard and fast rule about when you can go and you can't go to the GP. It depends on a lot of other factors as well. But generally speaking, we say if you're above 40, go and pay a visit to your doctor, get your blood pressure checked, get your blood test done, check your cholesterol and stuff. Plus, if you have any family history of any significant problem, for example, any kind of cancer, for example, heart problems and things like that, then it becomes even more important. So, yes, so at the age of 40, we advise patients to go and have a general chat with the doctor. You'll be surprised nowadays how many cancers we have diagnosed, for example, a prostate cancer in early stages, where there's a high risk in family among 40s and 50s. So,
and is this because you just know the right questions to ask?
Yeah, I mean, family history is very important. If somebody come to me and tell me, even if they're 40 and they say they have a family history of a prostate cancer, I always check the blood test PSA level, which is a non-invasive test. It gives us an indication, and it's a preventable thing which can be caught early and treated very well.
We're going to come back to your role in a moment, but I just want to touch on briefly the alternatives out there, the extra support that you get, because we hear about the waiting lists sometimes at GP surgeries. People have to wait for some time for an appointment, and there are alternative ways of getting information. So let's first of all talk about pharmacies. They seem to be taking on a bigger role these days.
Yes, pharmacies are taking bigger roles, and they are quite good in advising patients for minor ailments, for example, cough, cold, flu. Pharmacists are also giving flu jabs nowadays, which are found to be have a great role in prevention of a lot of serious illnesses actually, and quite easily accessible. They also advise patients of smoking cessations, and also advise when to go to the doctor as well.
Exactly. I mean, that's a real key, isn't it? So if you're in slight doubt, well, just go and see your GP, your pharmacist, and they'll tell you whether you should be going to see the doctor or not.
I agree, yeah.
Yeah. And then, of course, we've got the NHS phone number.
Yes, NHS have also advised lines. For example, 111 is quite popular nowadays, which help patients not only to get some advice, they can also guide them in the right direction as well, where to go and who to speak to. We see loads of patients who are diverted through 111 to general practice and to A&E as well.
And when you talk about these extra sources of information, you do have access to a lot of different specialists there, don't you?
Yes, we have access to almost every speciality actually, and if we are concerned, then we can refer them directly. There are two types of referrals. One is normal referrals, and one is urgent referrals. And the third one, actually, I'm sorry to mention, is a 2-week referral for cancers as well. So we use it as needed, basically. The other thing which is quite good is that majority of the places, GPs have a very good relationship with their peers at hospital, and that helps a lot. So, for example, in my area, we know a lot of consultants, and if you're concerned, we can even sometimes email them or informally ring them to get some idea about one patient where we're not sure what to do.
And that really is what this is all about, isn't it? It's just going and talking to somebody because they are the professionals, they will be able to help. And I know one of the areas that you particularly specialise is in skin care and skin problems, because again, that could be something that some people think is quite a small issue, not a big issue, maybe it's not easy to deal with. Yet, as a specialist in that, it is something that you should go to your GP about.
Absolutely. I think one of the main issues with the skin is skin problems are very common, actually. But people don't know what to do and where to seek the help. For example, acne. A very common issue, and patients don't know what to do. And I've seen so many people who do all sorts of alternative. I'm not saying don't do alternative therapy, that you should try everything first, but in some cases they're so severe, but they carry on trying the alternative therapy for such a long time and making the problem worse, actually. So I always advise, even if it's mild, go and speak to your doctor, and they can advise you and guide you in the right direction so that you don't make it worse, basically.
And actually, talking of of those kind of things, you talked there about alternative therapies and things. The NHS has actually got more and more into this these days, hasn't it? And it seems to consider a lot more alternatives, especially when we look at things like back pain.
Yes.
You know, there's a lot of different routes that people can take there.
Yeah, absolutely. So back pain is a very good example, actually, and it's a huge workload for us on a day-to-day basis. For alternative therapy, acupuncture is very useful for backache. You mentioned about yoga. There's so many other exercises and clubs which helps and provide different alternative therapies for the patient as well. Physiotherapy is very good, actually, for backache as well. Nowadays, it's we're trying to make it easier, the access of patients with back problems to access these things. I have great stories from patients who suffer from backache, how it changed their life, actually. Recently, I saw a patient who was suffering from backache for a while, and he went to the physiotherapist, who was a specialist in acupuncture as well, and he said, let's try it, and it really worked for him, actually. So yes, it does help. Obviously, every patient is different. I always advise that, look, if this doesn't help, it doesn't mean that nothing will help. Try different things.
Well, that's the interesting thing, isn't it? Because you have it's an overused word, but you have a holistic view of your patient. You know what they've tried, you know the different things, and that might help guide you to guide them in the right direction.
Absolutely. So this is very important. I think you have to be very open about the problem with the patient. So suppose, let's say, if somebody's coming for the backache, as we're talking about it, I think you need to tell the whole story about backache, the prevention, how to manage it. I give you example. I just saw a patient recently. She works for catering industry, and she suffered from recurrent backache, and but work is important, obviously. Whenever she get a bit of a backache, which is kind of a back sprain, the commonest form, she don't stop working. And what happened? It prolongs the whole episode, basically. So instead of taking 2 days off, she take 1 month off, actually, because she's not careful in the beginning. So we always advise the patient. So patients with the recurrent problems like backache, we advise, look, when you start feel niggle, do these exercises, rest, do the physio, so that you nip it in the bud.
And it's interesting that you have such a broad knowledge. What's been some of the most unusual things that you come across as a GP? I guess you're in a position where almost nothing shocks you anymore.
Yeah, I mean, sometimes you can have very interesting cases. The most interesting one I found is the one where the physical issues link up with the mental health issues, actually. And I think this is a very difficult area for the doctors as well, because we can see physical problems either on the blood test and X-rays and investigations, but we can't see mental health problem. One example, actually, we did a project in our area where we were trying to identify those patients who were frequently attending the hospitals or A&E because of the health economy issues nowadays. So we thought that we'll deal with these patients on the primary care level as much as we can, so that they don't end up in the hospital. And we found one of our patients attended A&E and used the emergency service for almost 35 times a month. And the cost of that individual in 6 months goes into millions, actually. It's just one patient. So that really triggered the whole system to do something about it. And we did basically a multidisciplinary approach to the patient. And we found that he was suffering from severe health psychosomatic anxieties, and he was not ready to accept that. We really struggled, actually, to convince him for a while. But at the end, we managed to agree, and he agreed, and we audited him again. And in last 6 months, he only used twice. So huge change and huge saving for.
And it's amazing how broad your remit is. One of the things that we're very aware of on this show is the viewers that we have who come from predominantly the BAME community. Are there issues there specific that you notice as a GP that are specific to that community?
Again, I think health education is the biggest issue. Socioeconomic issues are another thing, but reluctancy to go to the doctor and telling them about their problems, reluctancy to be referred to the specialities. This is the biggest problem. I think there is a need for educating this community, and I think. If we educate them, I think not only we're going to treat the patient properly, I think it will lead to a prevention as well. Don't forget, a lot of communities you're talking about are high risk for diabetes, blood pressure, and cancer. And I found the information they have is not as good as the other communities, to be honest with you. So I think there's a huge need to educate those patients, spend more time, understand their socioeconomic issues. Language barrier is another problem where we struggle sometimes to make the patient understand these things. So yes, it is quite. But I think the role for the general practice in that regard is try and educate the patient along with the treatment as well.
And one thing to bear in mind always is if you come from that community and you live in an area where there are many other people from the same community, there's a very good chance that the GPs will have heard this all before.
Absolutely, yeah. It's a very common issue, and I think again, patient taking initiative is the key. If somebody's suffering from some illness and they're not going to tell anybody, how are we going to find out? So. There are so many factors which make them not to approach anyone. It could be their family issues, education. One more thing which I found is that they don't understand what it can lead to. Small issues, but small issues can become a bigger issues, basically. For example, in one of our community, they eat a lot of what you call betel nuts and other bits and pieces, and it's a high risk for cancer. And recently, actually, one of my patients who I always used to tell him and they chew tobaccos as well. So I always used to tell him, look, don't do that. And just recently, actually, a couple of weeks back, I saw him and I saw something which was quite similar to cancer of the mouth, and I did refer him to the cancer specialist. He's under investigation, but the point is that was an issue which we were discussing constantly. But again, so I think patient education is very important in that community.
And especially when we get older, you talked about 40 being an age when you need to start familiarising yourself with your doctor, going for the odd checkup or just for a chat. Yeah. What are some of the other things that you're noticing? We are an ageing population. That's obviously putting a big strain on our NHS. What are the sort of things that you find that older patients are coming to you for?
Older patients, are obviously coming majority of time for chronic health problems, hypertension, blood pressure. I mean, with the chronic obstructive lung disease, asthma, another chronic problem, heart failure is another one. I think again the core issue here is identifying the problem and them coming to you at the right time so that they can have a quality life and manage the problem appropriately. There's no point of coming when the lungs are literally given up actually and you smoked all your life. So I think the earlier you go to the doctor, the better outcome is for you.
And again, the doctor will be familiar with your case history, which is, again, massively valuable when it comes to going to a specialist. What happens after you recommend someone goes to see a specialist, whether they end up having to maybe go to a hospital or seeing a surgeon or something like that? What's the role of the GP then? How involved are you once you've referred them?
So it depends on the referral and type of referral. So, for example, a patient who is coming to you for memory impairment, we have a guidelines to do certain tests before we can do the referral of the patient. We have to exclude any kind of physical health issues and heart issues and things like that. And after that, we can only refer the patient to the specialities. In some specialities, we don't have to do everything. We can refer them directly as well. I categorize them into two categories. One is non-urgent, one is urgent one. In urgent, obviously cancer one is also included in that. In non-urgent, normally if we are worried about certain problems, depending on the specialty, I gave you example of dementia, we do some investigation, but not necessarily even everything. For example, a skin lesion I'm worried about. Although I know that's not a cancerous, but we want to get more opinion from somebody. So,
and that's the real key, isn't it, with all of these things, as we've discovered earlier on talking, is the fact that if you have any of these small niggles that you're concerned about, you know, however small they are, you should really get some help. And most importantly, I think our message is see your GP.
Absolutely.
Fantastic. Thank you so much indeed. It's been great, and I've certainly learned a lot. As usual, I always do in this show. It's brilliant. Thank you very much indeed. But unfortunately, that's all we have time for. I'd like to thank our guest today, Dr Imran Gohar. As we heard, he's a general practitioner from Sydenham House Surgery in Harlow. And really to thank him for coming into the studios and discussing the reasons for visiting a GP and what you can do and what we can all do to improve our health. Now, once again, we must stress that should you suffer from any medical problems or any health concerns, it's always highly recommended that you contact your doctor or GP, as the Health Show gives you an alternative viewpoint to the health concern being discussed. As always, if you'd like to find out more about this or any of the subjects we've discussed on the show or this series, then please do email us at healthshow@islamchannel.tv. Again, get in touch with us anytime at the channel healthshow@islamchannel.tv. That's our email address. But for now, it's goodbye from me, and we'll see you next week. Assalamu alaikum.